Hey, Psychogoers. Have you ever confused the signs between bipolar disorder and clinical depression? Clinical depression and bipolar disorders can be confusing as they often have overlapping symptoms. Two people battling the same mental disorder may also exhibit symptoms in different ways. Seeking help from licensed mental health professionals is the best option. However, learning the basic differences between these two mental illnesses is a great first step. Before we begin, we would like to mention a short disclaimer. This video is only for educational purposes and for those who want to learn more about bipolar disorder and depression. Please do not use this video to self-diagnose. If you can relate to this video, we advise you to go to a qualified medical health professional for proper diagnosis. With that being said, let's continue with the video. So, what classifies as major depressive disorder, commonly known as clinical depression? Clinical depression is a mood disorder that is a combination of symptoms, feelings of intense sadness, guilt, or hopelessness, restlessness or anxious movements, a lack of interest or pleasure in activities that were once enjoyable, irritability, fatigue or lack of energy, difficulty concentrating, changes in normal sleeping and eating behavior, usually dramatic increases or decreases, and in some cases, suicidal thoughts and actions. Symptoms must persist in a person for at least 2 weeks before they can be diagnosed with depression. And what basically is bipolar disorder? Bipolar disorder is another mood disorder characterized by heightened, often intense emotional states called mood episodes. These mood episodes fall into manic, hypomanic, a less intense manic state, or depressive categories. So, what are the differences between depression and bipolar disorder? 1. Manic episodes. The major difference between depression and bipolar disorder is the presence of manic episodes. Now, what basically qualifies as a manic episode? A manic episode is a mood episode categorized by the following symptoms: extreme multitasking, grandiose or egotistical feelings, faster speech patterns, distracted thoughts, periods of less sleep, and risky behavior such as gambling or spending sprees. People with depression never experience manic episodes. People with bipolar disorder usually experience both manic and depressive episodes. But those diagnosed with bipolar 1 disorder may never experience a depressive episode. Sometimes people with bipolar disorder may experience a manic episode and a depressive episode at the same time. 2. Diagnosis. Depression is more common than bipolar disorder. According to the American Psychiatric Association, 1 in 6 people will experience depression at some point in their lives. In contrast, only 4.4% of people will experience bipolar disorder in their lifetime. Because depression is more common, there is a chance that people with bipolar disorder could be misdiagnosed with depression if they seek treatment during a depressive episode. For this reason, mental health professionals inquire about patients' histories so they can identify possible manic episodes and avoid misdiagnosis. 3. Causation and duration. Bipolar disorder is a lifelong disorder, and although it cannot be cured, it can be managed over time. Most people are diagnosed with bipolar disorder in their late teens. But diagnosis can also occur at later ages, depending on when people recognize their symptoms and seek professional diagnosis. In contrast, depression can occur at any time throughout a person's life. While depression can last for a long time, many people are able to cure their depression and begin by taking antidepressants for 6 months to a year, and then slowly weaning themselves off the medication to see how they're progressing. Both disorders are caused by a variety of factors, from genetics to substance abuse to traumatic experiences. 4. Co-occurring mental disorders. Many people with bipolar disorder develop another co-occurring mental disorder as well. According to a study by the US Department of Health and Human Services, about 92% of individuals with bipolar disorder will experience a co-occurring mental disorder in their lifetime. People may commonly experience one of the following disorders at the same time as bipolar disorders, such as anxiety disorders, ADHD, substance abuse disorder, and eating disorders. While people can experience co-occurring mental disorders with depression, depression is often the co-occurring disorder itself, meaning that people suffering from a mental disorder often get depression on top of their pre-existing disorder, and the depression can be cured without curing the other disorder. With bipolar disorder, it's the other way around. 5. Treatment. According to the American Psychiatric Association, psycho or talk therapy is used to treat both depression and bipolar disorder. Antidepressants are also commonly prescribed for both. However, antidepressants can trigger manic episodes in people with bipolar disorder. To help prevent this, mood stabilizers are paired with the antidepressants in treatment for people with bipolar disorder. This is another reason why a proper diagnosis is so important, as self-medication can lead to aggravating the condition further. Bipolar disorder and depression are both treatable, given the right psychiatric care, but it's important to know the difference between them in order to get proper treatment. While they may look similar at first due to their shared depressive episodes, their differences, especially the presence of manic episodes, are significant and can make all the difference in getting the right treatment. If you found this video insightful, share it with others who might benefit from it. Don't forget to hit the like button and subscribe to Psych2Go for more psychology content. Thanks for watching.